Students, as a part of nanomaterials, today I'm going to discuss the application of nanomaterials in medicine and catalysis. First, I will discuss the application of nanomaterials in medicine. When the drug is administered in our body, it should reach the receptor and show its activity. Now, what is a receptor? Receptor is a protein which bind to ligand, which is so called as drug, and cause responses in the immune system. Now, what is the size of these receptors? The size of these receptors is around 5 nanometers, and as the size of nanomaterials is in the range of 1 to 100 nanometers. Nanomaterials are compatible, biocompatible with receptors. Moreover, if you see this figure, the size of the virus is around or less than 100 nanometers, which is mainly responsible for most of the diseases. Due to their size, nanomaterials are also biocompatible with virus. Furthermore, the size of cell membranes in our body is around 4 to 10 nanometers, because of which nanomaterials based drug molecules can easily cross the biological barriers such as cell membranes and can reach the receptor site easily. In most of the conventional drug delivery procedures, the drug circulates throughout the body. As a result, only little portion of the loaded drug reaches the part or receptor needs the treatment. In this context, targeted drug delivery came into picture, which is the use of some molecular recognition systems or some coatings. So, the drug is released only to the desired section of the body. Targeted drug delivery is quite important as it would avoid killing of healthy cells, rather kills the affected cells. There is a considerable nanotechnology based research going on to help diabetic, HIV, cancer patients. Use of appropriate nanoparticles like micelles, liposomes, nanospheres, core shell particles, albumin-based nanoparticles, or dendritic polymers enable to achieve these goals in the modern nanomedicine techniques. So all these are compiled in the following figure. They are coated with small molecules, proteins, or peptides. Often, the nanoparticles themselves may be effective as they may store drug inside them and release when they get to the targeted site. Initial tests of various drug delivery systems, cancer or tumor therapies or detection have been successful using nanotechnology. Nanoparticles, being very small, are easy to inject and target towards specific portion in a body. Particle surface can be modified using some functional molecules which can then go to specific receptor site. Some of the important examples of drug delivery systems are in cancer therapy, insulin delivery, and treating Alzheimer as well as Parkinson disease. The scientists have developed novel nano carrier systems to deliver cancer treatment drug to cancerous cells without affecting the healthy cells. This avoids excessive drug circulating in the body, causing toxic effects. Some of the drugs are also not easily soluble in many solvents. In such cases, nanocarriers turn out to be effective means of drug delivery. These are the various nanostructures containing the molecules, groups, drugs used for diagnosis and treatment of disease. Yellow color attached to these nanostructures are targeting molecules. Yellow color attached to these nanostructures are targeting molecules. You can see over here, targeting molecules. Orange color attached to these nanostructures are polymeric chains. Black color attached to these nanostructures are aptamers. What is an aptamer? These are the oligonucleotides or peptide molecules that bind to a specific target molecule. Purple color attached to these nanostructures are antibodies. Now, what are aptamers and antibodies? First, what are aptamers? These are oligonucleotide or peptide molecules that bind to a specific target molecule. What are antibodies? Antibodies are a large Y-shaped protein used by immune system to identify and neutralize foreign objects such as pathogenic bacteria and virus. Now coming to the light green color attached to these nanostructures are linear molecules. So you can see in each and every nanostructure, linear molecules. Green and light orange color attached to nanostructures are lipid molecules. Pentagon shaped red color attached to these nanostructures is hydrophobic drug or hydrophobic part of the drug, we can say, pentagon, hydrophobic part of the drug, and spike shaped red color attached to nanostructures are imaging agents or imaging agents. So this is about the various nanostructures comprised of molecules, groups, drugs used for diagnosis and treatment of disease. Now let us discuss the application of nanomaterials in specific disease, that is in cancer therapy. Genes control the growth and division of cells. If genes are damaged, the cell growth is uncontrolled and obstructs, means blocks the normal body functions, leading often to death. There are various types of cancers, but the main cause for cancer is the cell growth. If not treated in early stages, it is fatal, means causes death. The early detection of cancer has been claimed to be possible due to nanotechnology based diagnosis. This would enable to treat the patients before it is too late. As discussed earlier, the drugs can be encapsulated in nanocapsules and targeted towards desired part of a body. Drug can then be delivered at a desired rate by opening the capsule using some external stimulus like magnetic field or infrared color under some physiological conditions. Targeted drug delivery is quite important as it would avoid killing of healthy cells. You can see over here. So it is not killing the healthy cells, it is killing only the cancer cells. Killing of healthy cells, unlike in chemotherapy. So what happens in chemotherapy? In chemotherapy, even the healthy cells are being killed, but it's not happening in this particular cancer therapy making use of nanotechnology. In fact, targeted chemotherapeutic drug delivery has been successful. In this, the cancer cell targeted is exploded and destroyed when encountered. So this is about the application of nanomaterials in cancer therapy. Now let us discuss the applications of nanomaterials in catalysis. While explaining the catalytic properties of nanomaterials, I have clearly mentioned that nanomaterials are associated with high or large surface to volume ratio. And why already I have clearly explained while explaining the property of nanomaterials. Due to which nanomaterials are excellent catalysts. Moreover, nanocatalysts improve the selectivity of the reaction by allowing the reaction at a low temperature, reducing the occurrence of side reactions higher recycling rates, and recovery of energy consumption. Therefore, these nanocatalysts are widely used in green chemistry, environmental remediation, efficient conversion of biomass, renewable energy development, and other areas which have been depicted on the slide. So examples of nanocatalysts includes palladium, iron, gold, nickel, platinum, rhodium, graphene oxide, etc. So this is about the application of nanomaterials in medicine and catalysis. I hope you understood this topic. Thanks for watching this video. Thank you.